Hey, I'm Antonio Neves from the Dot News. Do you think it's okay to take a pill that a doctor prescribed for someone else? According to a 2008 government report, about 1/3 of teens do. Now, for the record, the answer is no. Doctors tell us that it can be extremely dangerous to take a prescription medicine without a doctor's orders. It's one of the main reasons that so many people are concerned that teens learn to separate the facts about prescription pain medicines from the myths.
I felt really bad. I felt mad at myself for letting this happen, let myself get addicted to drugs.
I had this mentality that the rules didn't apply to me, that I was different.
I'm still paying the price for that.
All the trouble that I've been through, it's just not worth it, you know.
Gabriella, Kyle, Haley, and Tim all became addicted to prescription pain medicines while in high school. They misunderstood the risks of abusing prescription medicines. At this hospital, pharmacists prepare prescriptions, the medicines doctors specifically order for their patients. Prescription drugs are powerful and dangerous if used improperly.
So physician needs to be overseeing the medication that the patient is taking. And
Marwa Shadi supervises the pharmacy at a major hospital in a Washington, D.C. suburb. She says there is a big difference between drugs that require a prescription and medicines anybody can buy without a doctor's approval.
Over-the-counter medications really are not as strong as the prescription drugs.
When ordering medicines, doctors make sure each prescription has the correct dosage, or right amount, to meet a patient's specific needs and physical condition. Doctors determine how long a patient should take a drug and also consider other factors like a patient's age, weight, and gender. Taking prescription drugs without a prescription is not only illegal. Nora Valco, director of the National Institute on Drug Abuse, says it's very risky.
So when one gets the same medications without a physician overseeing them and without really having an idea how to take them, that can become very problematic. Doctors prescribe them on their very specific conditions, whereas when people start to abuse them, they use it very, very differently.
Some of the most dangerous prescriptions are for pain. They're called opioids. That's because they target opiate receptors in the brain.
And the opiate receptors normally are in our brain to actually regulate pain. And this is exactly why these drugs, when improperly used, can lead to drug addiction.
The brain also controls breathing, and the drugs can interfere with the respiratory center in the brainstem, shutting down breathing and leading to sudden death. Haley Norwood is a recovering addict. She didn't think pain medicines were dangerous because she found them in family and friends' medicine cabinets and because they were prescribed for others by a doctor.
I knew it was what it was supposed to do, whereas something like ecstasy, I would have no idea.
Susan Foster of the National Center for Addiction and Substance Abuse at Columbia University warns that is simply a myth.
So they might say, these are safe. You know, what's your problem? My mother takes these or my father takes them. The real fact is that those drugs may be safe when prescribed for a particular condition, for a particular person. They are not safe if they are taken when you don't have a prescription yourself.
Myths about prescription pain medicines make it hard for many people, including many teenagers, to understand the damage these drugs can cause. Here are some facts. Doctors and scientists agree that abusing prescription drugs is as dangerous as other illegal drugs. They can lead to addiction, a very hard-to-cure disease of the brain where your body craves more and more of the drug. Even one use can be dangerous. Government studies say about 10% of teenagers abuse prescription drugs.
I was actually really surprised to find out that not everybody was, and I really kind of liked those kids that were involved in something that weren't, and they had their group of friends, and they were happy, and they didn't use, and they were like, cool, no thanks.
Haley has been off of drugs for 2 years now, but she says that she is still a recovering addict and always will be. For the Dot News, I'm Antonio Neves.